POTS, I've heard that it's called the invisible disease because I look healthy, and I feel like with POTS patients, like, you don't see actually what's going on underneath. I'm sorry. I don't want to cry. I'm sorry.
It wasn't until after my 10-day quarantine I went to the doctor to get cleared, and at that point the doctor said I was breathing at the level of an 80-year-old.
The hard part is that as you start to feel bad, you think there's something wrong with you mentally and that you have no stamina, and it's a problem of stamina.
My name is Lauren Turner. I am 21 years old and I play volleyball at the University of San Diego, and I tested positive for COVID-19 on February 26, 2021.
Yeah, it started when I got COVID. So I had been playing volleyball, everything was fine, and then I got COVID from someone at my volleyball club, and it just basically completely wiped me out.
Patty Stein, I'm 65 years old, and my current life is pretty much the same during the pandemic as it was before the pandemic, meaning that I have a pretty limited scope of energy.
Kind of pulling things together, POTS is a debilitating disorder that demonstrates symptomatic orthostatic tachycardia without changes in blood pressure.
Like from going from like sitting down positions to standing up, my heart rate raises extremely fast compared to a normal person's heart rate, which causes symptoms like lightheadedness, dizziness, especially brain fog, joint pain, tremors.
I'm having blackouts, dizzy spells.
Found that I just couldn't stand.
I have like this almost anxiety.
And when I couldn't drink and was so dehydrated, I was like a flower that, ran out of water.
That I feel so out of it 50% of the time.
Those panic attacks.
I just don't trust my body anymore. Hi there, how are you? I'm Lauren, nice to meet you.
Hi.
Then I want to hear what you're interested to know. But it helps me as a nurse to hear a little bit about how you got to where you are today in terms of your health and your outlook, and where you are kind of emotionally with your diagnosis.
Everything was so in pain, constant pain. I couldn't even bend my legs. I couldn't bend down to grab an object off the ground. I was so lightheaded and dizzy all the time.
I had chest pain, shortness of breath throughout my entire 10-day quarantine, and that just unfortunately never went away. Kind of like Emily, we went through absolutely every single test in the book, breathing, heart problem, every single thing, all the CTs, until the final tilt test, which diagnosed me with POTS.
It's a specific test that involves the patient being tilted to a standing position, usually somewhere between 60 or 90 degrees. And we try and see if we can get the patient to feel some of the symptoms that have been bothering them while we monitor their blood pressure and their heart rate.
That test was, 3 hours long, and they finally,
Well, it makes you feel so gross.
Yeah, it does.
Oh, I was describing it to Lucy the other day, and I just said, all I want to do is throw up.
I'm laying down to a standing position, and you just get all your symptoms come out.
Crying during it, sweating, and
Yeah.
I was like, are we almost done? And they're like, are you uncomfortable? I'm like, very much so, I'd like to be done.
From the point of view, how do I treat these patients? Usually for the first 2 or 3 months, you try to understand more what's happening with them, and we do lifestyle things first. requires a whole team. We need cardiology, primary care, pain management, gynecology, neurology.